Hi, my name is David Emerson. I'm a long-term cancer survivor, cancer coach, and director of People Beating Cancer. Welcome to the blog post regarding specifically AYA, adolescent young adult survivors, and that therapy, that procedure, which involves aggressive high-dose chemotherapy, lots of toxicity, stem cell transplant, whether it's autologous, your own stem cells, or allogeneic, a donor stem cells. The bottom line is the patient undergoes lots of toxicity. A growing number of studies document the long-term, late-stage, long-term side effects of all that toxicity. Let me also mention, even though I was 35, I was technically an AYA cancer patient. I think the range is something like 14 to 39, so that's a lot. The usual AYA patient is someone who undergoes a lot of chemotherapy in their teens. It's not me. However, I have lived now for 27 years since my diagnosis of my blood cancer, multiple myeloma, and 19 of those years in complete remission. And I've sustained lots of long-term side effects. So this topic is central to my existence. The study linked below pretty much says it all. Improving to where treatment-related health risks and perceptions of the future among adolescents and young adults after hematopoietic cell transplantation, stem cell transplant. While I can't paint a rosy picture of living 10, 20, 30 years after a bunch of toxicity, I can offer a personal experience that there are evidence-based, non-toxic therapies that help to either stabilize or perhaps even heal many of our long-term side effects. Let's be clear here. Conventional oncology, generally speaking, does not study. It's expensive and, according to research, difficult to follow patients for 20, 30, 40 years. So much of this is left up to the world of non-conventional therapies. And for argument's sake, that's me. I don't want any more toxicity. I've had enough. It causes problems for me. So the conventional world, while it's important to certainly go see your general practitioner and keep an eye on your skin, heart health, bone health, all that stuff, really conventional oncology is not going to offer many studies, many therapies to improve your health decades after high-dose therapy, stem cell transplant. So consider non-toxic therapies, non-conventional. They're based on research, but not conventional research, clinical controlled trials, that kind of thing. So for instance, supplementation, curcumin, black seed oil, omega-3 fatty acids, all which I take, daily exercise, moderate because I do have heart problems from my cardiotoxic chemotherapy regimens a long time ago. But I'm managing my my cardiomyopathy, chemotherapy-induced cardiomyopathy, with exercise, nutritional supplementation, nutrition, Mediterranean diet, those kinds of things. To summarize, the AYA patient, while it's certainly a downer to think about life with all these late-stage and long-term side effects, I believe there is hope. Certainly, in my world, in my view, I have improved, stabilized or improved many of my long-term late-stage side effects. Not perfect by any stretch, but there is hope. If you have questions, comments about any of the non-toxic, evidence-based therapies that I use, that I encourage you to consider. Scroll down the page, send me a question or comment. I will reply to you ASAP. In the meantime, hang in there and be well.